Charlie, and you are watching the Advocate Out and Equal Pride's Monkeypox vaccine and virus special. We're calling it MPV 101. We're going to take you on an in-depth look at the spread of the monkeypox virus, especially among gay men, who account for 98% of cases right now. How to prevent it, how to spot it, how to stop it, and where to go for help. And if you are being denied care, we want to hear about it at info@equalpride.com. So let's take a look at the latest study from the New England Journal of Medicine of where we are with the monkeypox virus, or MPV, as we like to call it. The New England Journal of Medicine just released their results after an extensive study of more than 500 men who have, 500 patients who have MPV. And here are some very top line stats. 98% of those, as I've said, that are afflicted are gay men. And this is why it's important to listen for all those gay men out there. 75% are white. The median age is 38. So that means we're seeing a lot younger cases than possibly we had with COVID. HIV plus people make up 41% of the cases. So you're more vulnerable if you have any kind of compromised immune system, even if you're undetectable. Smallpox vaccine as a child, 49% had, but there's something to know about it. The efficacy wanes. And if you've not had a refresh in the last 3 years, it does not provide that barrier of protection, just like we're seeing, and I'm one of those people. 95% of us have contacted it through sexual contact. I did. 95% have a rash. 14%, like me, got the very silent but very painful symptoms of proctitis, which is often misdiagnosed, as it was with me, as an STI. 73% of us get pox in the genital area. So it is not uncommon to have it on your penis, on your groin area, or your anus. Only 5% of us are receiving treatment, and that is actually a travesty. And we will be talking further about that, especially now that I am coming to you with a diagnosed MPV virus affliction. I'm currently in isolation and suffering from it. So I'd like to tell you my story. Firstly, let me state that I was vaccinated for MPV on July 8th. My MPV symptoms started on July 18th with mild but increasing anal pain when pooping, peeing, or even orgasming. I went to a physician when I woke up on July 22nd, just a few days later, and it was so painful, I could not even go to the bathroom. Come Monday, my pain was so intense that I could barely walk, but I was able to get it under control with some Tylenol, and I started to itch my arm with one pox there and the back of my cheek that looked similar. On Tuesday morning, I woke up and I went back to the doctor, and we both agreed that I needed to get tested for MPV. We agreed and we took action. They took a swab, they took blood again, and I started on antivirals on Tuesday of this week. And I have to tell you, they're making a tremendous difference. I also heard from our guest that I'm about to introduce about how to handle pain management. Dr. Carlton Thomas, he is one of the foremost gay men's health specialists. Dr. Rectal Pox is a Mayo Clinic trained board certified gastroenterologist who goes by Dr. Carlton on Instagram and TikTok and teaches butt stuff and queer health. He stepped up to address monkeypox when he made his first Instagram video about it on May 20th, more than 2 months ago, and sounded the alarm after realizing the potential connection between cases at Darklands and the looming fetish and pride events in the US and Europe, which are all coming up or have happened with Pride Month. He has spent the last 2 months tirelessly helping suffering monkeypox victims get treatment solutions, and has been a huge source of vaccination clinic postings, as well as helping a number of men get treatment, leading to many, many men saving their lives, potentially saving their quality of lives, and because of the 3 to 4 week window, their livelihoods. Welcome, Dr. Carlton.
It's so nice to be here.
Thank you so much under the circumstances. And thank you for interrupting your vacation to be with us. My first question is, what is MPV and the symptoms?
Well, the symptoms are initially flu-like with body aches, fevers, chills, swollen lymph nodes, night sweats. I actually had a follower send me a picture of their bed, and although it's not uniform, the whole bed was just soaked with sweat. And then a few days later, the rash that's characteristic of monkeypox starts appearing. And it's really variable on where that appears and how bad it is. I've had people that had just a few pox. It looks like a big pimple almost. Some have it on their face, some have it on their shoulders, their hands. Obviously, because of its skin-to-skin contact, a lot of tops get it on their penis, a lot of bottoms get it on their anus. So I've seen cases and pictures of people's penises and asses that look like a horror story. I'm telling you, and I've seen just tiny little bumps on some people. It really is variable in how it presents. So I've had people, especially the rectal pox or the proctitis part that you said that you had experienced, is the worst part of it all. It seems to be the most painful thing that happens to people. I think what happens in there is the nerve fibers are getting infected with this virus. I don't have any proof of that, but anecdotally, people are telling me that it feels like a potato peeler is corkscrewing up their ass, or a shard of glass is. And it's nonstop for 10 days and no relief. So the reason I think it's attacking the nerves is a follower of mine is a nurse anesthetist student and said, hey, I tried this medication called gabapentin or Neurontin, and I went from a 10 out of 10 on my pain level to about a 4 or 5 after one dose. So I think this might be something you need to explore. So I told about 50 guys, because I have this whole pile of guys that are on my DMs on Instagram who are in contact with me because they don't have any access to care. I said, hey, try this medication, ask your doctor for this medication and see if it works. And all of them responded back within 24 to 36 hours saying, oh my God, my pain level is down 75% from where it was. So, and this pain medication blocks nerve-related pain. So I think that could be what's happening there. So yeah, so rectal pain, people who have it in their urethra, which is where the urine comes out, have severe penile pain. Most penis cases that I have seen have been just little blisters on the penis, almost like herpes. It can be easily it can easily fool you into thinking if you just have genital lesions that it's herpes or syphilis, because the lesions look very similar. But the differing factor is the spread on other parts of your body, and then the prodrome of flu-like symptoms that we described earlier. So this happens over the course of a couple of weeks, and there's about a 5 to 10 day period where people are just in absolute misery. And in most people, their bodies just heal this infection over time, and the lesions scab up and they fall off. And that's when you're off of isolation. So it's really, so these are the symptoms as far as what you can expect. Now, again, it's variable depending on where you're infected, and not everybody has the same rash. But in general, I'm seeing tops getting it on their penises, bottoms getting it on their ass, and people who mostly just did oral have lesions in their mouth and their throat. So there definitely seems to be a point of entry as far as where the infection happens as to where some of the most severe lesions happen.
And semen also, we're finding, is containing a large amount of the virus as well.
Absolutely. And so this makes sense that it would be in these places, because that's where a lot of semen goes.
Right, of course. Absolutely. Well, fortunately, I did not have too many pox. and no visible pox on my anus, but I did have the proctitis, which was excruciating.
Right.
And I don't know if I could have gone through that for any more time than I had. So I really appreciate it. And it's hard for me to know that only 5%, according to the New England Journal of Medicine, have actually gotten treatment. So
Right.
let's talk about testing, vaccinations, treatment, and the pain relief. Can you get into a little bit more specifics about, how people what they should be doing? Because I was vaccinated, I definitely helping fight the disease. I think I went on antivirals, I went on pain relief. That's a trifecta. Many people aren't getting any of those.
Right, exactly. So first of all, recognizing the lesion so that you know what's happening. You have to actually get a scraping of the fluid in the lesion and have it sent off to a lab to get it properly tested for monkeypox virus. There were some recent studies, statistics given on labs that were available to test that had basically received no samples because people weren't sending them, or people aren't testing properly, or doctors don't know about this illness because it's new. And people are going to the emergency room and telling people the same symptoms that you're describing, and they're getting treated for syphilis instead of monkeypox.
Right.
There's a big confusion in the medical community, and medicine is homophobic as well. I've been in many doctors' lounges in hospitals, and it's always blasting Fox News in there. So medicine is definitely homophobic. It's confusing a lot of care providers because of lack of education to the general public, which is sort of I think that's a failure of the central government to not get more information out to healthcare providers. We need to educate our healthcare providers about what to look for. We need to educate our public about what to look for. So proper testing, it can be a struggle depending on where you are. A lot of people initially had to go through their health departments. Now doctors' offices can do it, but a lot of doctors don't know what to do. So it's important to stay in contact with your local health department or your primary care physician to see if they are prepared to test you, or the steps that you need to go through for testing. Sadly, one of the worst parts of this whole process is that it's not a centralized, uniform process for everybody. You can be in a place like Massachusetts and New York and San Diego and Los Angeles and get proactive preventive vaccination. Or you can be in Texas where they're only giving it to people who've been exposed.
Right.
I think Texas or they're exposed and they still don't get it. I think Texas initially out of the almost 80,000 vaccine doses, or 60,000, whatever was available in the beginning, Texas got 700, and that it has like almost 30 million people, compared to California and New York, which got thousands more and did the whole proactive approach to things. So there's definitely a disconnect in vaccine equity. I think the state of Delaware had 2 initial vaccine doses. My husband and I got vaccinated in San Diego. We got in the car and said, "Hey, we have as much vaccine in this car as Delaware." I
don't mean to laugh.
They have a million people. So it just makes no sense.
They also have a gay destination. Provincetown, just like Palm Springs, just like Wilton Manors in Florida. All Absolutely. Of them are out of right now in Provincetown out of vaccines. The issue is we need to get vaccines to people who want them. Okay.
Absolutely.
We've got inequitable, unconstitutional, and inhumane treatment. Speaking of which, let's move on to the next question. 98%, according to the New England Journal of Medicine, are men having sex with men. And in fact, I will tell you, here in Provincetown, I was on I opened the first LGBTQ welcome center, and the state Mass Department of Health was a sponsor. Why? Because they wanted to reach men, not just gay or bi identifying men, but men who have sex with men, even if they identify externally as straight.
Mm-hmm.
So there, this could leap into our female population, our pediatric population, our elderly population, because many of us are caregivers for our parents and other loved ones. So how do we men, us gay men, take responsibility and stop the spread? Now, I don't want to tell people to start having sex because but we all know how that goes.
That goes over like cat shit lip gloss. I think that although nobody wants to hear that, they need to hear it right now. I'm the most sex positive person on social media when it comes to being a physician, and TikTok and on Instagram. But there comes a time when we need to take personal responsibility for what's happening. Vaccines are preventive. If you can get a vaccine, get vaccinated. Until you can get vaccinated, you got to start minimizing your risk factors. So no bathhouses, avoid circuit parties, avoid close contact situations. Don't go to orgies. You're setting yourself up for a month-long isolation if you decide to go that route. And and people are grown, we're grown adults. We can make the decisions that are, that we feel are best for ourselves. But honestly, this is a time right now until things settle down where we really need to be aware of what's happening, because there is a physical toll, an emotional toll, and a financial toll that comes with this infection. When being in isolation for such a prolonged period of time, there's a lot of shame and stigma that people are getting about this disease, which is completely unacceptable because it's just an infection. And people get it the same way that, hell, a month ago, I was in Palm Springs and was probably doing the same thing you did when you got your infection. It doesn't make you any less of a person than I am just because you got an infection. It's ridiculous. Infections are just infections. They're not anything to be stigmatized or shamed over. So I think people need to take a step back from the shame and stigma, realize that it can happen to anyone, realize the financial toll of not being able to work for a month, the psychological toll of being locked away in isolation for a month, and then the severe pain that people are going through when they have these pox lesions. There has to be, we have to educate each other. We have to change our behaviors as much as we can. I'm not telling people to stop having sex, but try to find alternatives as much as we can until things kind of settle down a little bit. Cyber sex, circle jerks, where you at least jerk off with people in the same room, but not touching each other, or have a small circle like a pod where you have a trusted circle of people who aren't going to go outside of that pod and have sex with them. Just coming up with alternatives, because in our community, abstinence is not going to happen. I mean, I can preach it till I'm blue in the face, but it's just not the way we're built. Yeah. It's not natural for us. So do as much as you can, but we're all human, is what I'm trying to say. So changing behaviors as much as you can, getting vaccinated, educating each other, supporting each other is really key. You mentioned the mental health aspect. There's a monkeypox support group that I have on my Instagram page that's run by a guy in New York who has monkeypox. And that's been incredibly helpful for guys to just be able to come into this Zoom meeting together and share each other's stories, share each other's pain, and help support each other through what's happening.
Thank you for that. I plan to join tonight for the first time.
Oh, that's great.
I just found out about it. So I think finding that, but I'm really encouraging all of my friends that I love here to take those precautions. I do have friends like you calling me, FaceTiming me from Rome, from Paris on vacation, from Hawaii, saying, do you think this is monkeypox? Do you think that,
Oh, yeah.
Two of them, I was definite. One of them looked like a heat rash, quite honestly. So that was good news. Yeah. But, I think you are making yourself available. I am as well to our viewers and listeners. Mike@equalpride.com. If you're having any problems getting treatment, you write us and we're going to help you. Okay.
Absolutely.
Yeah. Well, I have to tell you, this has been great. Don't go away. We're going to spend just a few minutes, Dr. Carlton, and you can certainly chime in, but I'd like to move on to something that's actually very important, and that is what to do if you are in a household with other people, and what you can do to minimize that as well. So I'd like to talk about that for a minute, if I could. So, and I'm fortunate, I'm living alone, so I'm able to isolate without much problem.
But like you said, I have people who are contacting me saying, "Hey, I have a roommate who I share a room in the same bedroom. I have a bed and he has a bed next to me, and I haven't told him I have monkeypox yet because I have nowhere else to go, and I'm afraid if I get kicked out, then I'll be on the street, and then what?" Or a multi-generational home where there's a grandpa and a grandma and to a mom and dad, and then a bunch of siblings, and then nephews and nieces. It's really complicated. Not everybody has their own apartment in New York City, you know?
So let's talk about people who are home. Here are some things that my public health department said. Please add to this. First of all, it said, don't leave your home or property. And if you do, go out for your medical exam, but wear a good fitting mask and medical gloves, such as latex gloves or something similar. Don't have prolonged conversation with people in person. 3 hours is viewed as a lot, I guess, but, just keep it very minimal and distance. And I'm talking through my screen door to people, which has been sort of fun. Refrain from sex, obviously, except for masturbation, which is actually making it through my day, to be honest. Isolate in your room, and if possible, use your own bathroom or part of the home, that does not interact with others. If you do, and this is where it comes to, right, other people, move to another part of the house if you can't sleep. Wear a good fitting mask and glove and latex gloves when you're in the kitchen or you're in common space, even a common bathroom. And I know this is a pain. This is hard. You care about the other people in your home. It is a short stint, fortunately. And the good thing is you'll be immune afterwards. Put a sheet down or on any surface you sit. Don't allow pets to really touch you. It's hard, I know, but if you can, especially if you have pox on your legs, keep those covered. Keep your body covered, those lesions covered. Wash your clothes frequently. Wash your sheets frequently. Now, if you don't have a washer and dryer, put your clothes, and somebody else is going to do it for you. Put them. Don't flip them or throw them in the air. Just carefully fold everything up and put it into garbage bags that you can tie off and seal. And the person who does your laundry should do that with gloves if they can help you. Virus survives a long time after you're done. So you really need to think about cleaning your whole house very well, and also having your furniture steam cleaned, I'm told. So these are things you may want to add to that, but that's what I'm learning.
Lysol works great. It kills this thing. So use, if you got to go to the toilet and share a toilet with somebody else, make sure that you wipe everything down great with Lysol wipes, and use Lysol spray in between bathroom visits. So especially if you share the same bathroom. But all those points that you mentioned are great points. And I think it harkens back that we need to, I know we talked a lot about the sexual part of things, but this is a close contact thing. So if skin to skin contact, if those lesions weep on other materials that other people share, that can be a potential source of spread. We're not seeing that way of spread very much. It's mostly been, like we said, through sexual activity, but there is a potential for those lesions to weep on other surfaces, on linens, and those things can be infectious to other people. So good points.
Okay, thank you. So now we're going to move to, so where do we go for help? The first and foremost is to contact your primary care doctor if you have one. Now, I know many people don't have one, so you may want to call your local health facility or your local health department on where vaccine testing and treatments are available. We have already said they're very tough to find, but it's something that you need to make your pursuit, maybe as much as sometimes our next sexual conquest. Also, visit the cdc.gov. They have very good information. They also have a complete listing of facilities that you can contact. Look at our media outlets, including HIVplus.com, advocate.com, out.com. We're constantly refreshing and updating our information, and we're here to help. Just reach out to us and contact. And of course, if you're being denied treatment, Dr. Carlton is getting a lot of DMs. you can write me at mike@equalpride.com, and we will do everything we can to help you. Other resources, Dr. Carlton?
Yeah, there's a central spreadsheet right now going around created by Grant Roth. It's at g.roth on Instagram. It's at the top of his page that is basically a central source for the entire country of where to get vaccinated. I have it all. I have a lot of them listed in my story. Anything that new comes up daily, I put in my stories on Instagram, and then I save those stories to my highlight reel, which is underneath my profile picture on my at Dr. Carlton on Instagram. But he also has a beautiful Google spreadsheet there. There's another person named at McSteamworks, MCSTEAM Works, that is helping people get access to TPOX. So if you're having problems getting TPOX, then he can point you to a provider in your area that can get you TPOX. There's a Google Doc on my Instagram as well. If you live in New York City, how to get TPOX. There's
TPOX,
all kinds of.
TPOX is the.
It's the antiviral. Yeah, it's the antiviral medication that you mentioned that only about 5% of people are getting,
right.
Because it's a part of the national stockpile. Your doctor has to write an IND through your local health department, which is a 20-page document of signatures that's from 1532. That is just a nightmare, and doctors don't get paid to fill out paperwork. So a lot of them don't want to do it.
I want to thank you so much for taking time out of your birthday. Happy birthday.
Oh, thank you.
And your schedule. We will get all these links. If we need anything, we'll contact you. But you have been an absolute savior for us in this country for working on this for us gay men, for working on it for the entire population and stopping the spread. And we will be talking a lot more. Thank you so much, Dr. Carlton.
Absolutely. I look forward to it. Thank you so much, Michael.
Well, thank you everybody for joining us today for MPV 101, everything you need to know about monkeypox. Please be safe and have a great, great day.